What are professional boundaries?
Introduction. Relationships are a key component of social and healthcare. Promoting the well-being of those providing and utilizing social care services can benefit from the ability to establish trusting and rewarding relationships with a variety of service users, including carers. However, laying out a clear foundation about the parameters of working relationship right away will enable both service providers and clients to examine their expectations and figure out how to collaborate most effectively. In this module, we'll cover the fundamentals of professional boundaries, their origins, and why they're necessary. Learning objective. By the end of this module, you will be able to understand what is professional boundary, learn about the history of professional boundary, discuss the need for professional boundary, explain key terminologies used in health and social care. Professional boundary. A collection of norms, expectations, and rules are known as professional boundaries. This establishes the moral and technical benchmarks in the social care context. They also establish guidelines for workers' safe, respectable, and productive behavior. The origins of contemporary professional boundaries are many. Others come from laws or official government documents. Others are outlined and codified in quality standards. Some are accepted as good practice, and some can be found in the policies and procedures of organizations. The therapy process, practical issues, money, client and worker safety, health and safety, and other factors all play a role in their motivation. As a result, boundaries has come to be a catch-all phrase for a wide, diverse range of laws and regulations. In the end, professionalism is about doing a good job and conducting yourself in a way that is consistent with the standards set for you. Working in the health and social care sector entails a certain level of accountability. History of boundary. The Hippocratic Oath is the earliest known collection of ethical guidelines for professionals in Western culture. Approximately around the 5th century BC, the ancient Greeks created a code of ethics for doctors and other medical professionals. The oath included, amongst other things, the following boundaries. You must be aware of your knowledge's limitations and avoid going beyond them. To the best of your abilities, you must work for the patient's welfare and avoid hurting patients. You shouldn't engage in sexual activity with somebody who is associated with your job. The specifics of your work with clients should remain a secret. Even though the oath was intended for medical professionals, it contained many ideas that social care professionals still use today. The need for professional boundary. A position of power over your customers will always exist for you as a health and social care professional. In most situations, the employee will be regarded as the expert. Clients will regard you as having the expertise and experience necessary to support your opinions. In most situations, you will also have actual authority. You have a job title, a location of employment, other employees to help you, and the power to deny a client access to a service they require or desire. You could also give a client access to other services, money, or different kinds of support or recognition. You are in a strong position in regard to your clientele because of all these variables. Clients will always be in need of assistance and frequently be in a vulnerable position. The power disparity makes them vulnerable to you and your relationship with them, even if they are not weak in any other context. You are now in a position of authority and control, and authority entails responsibility. You will be required to the best of your abilities, assist and support customers while making sure that your actions do not harm them. Make sure that wherever possible, your decisions are based on the demands of the clients. In all of your interactions with and on behalf of clients, behave in a trustworthy and responsible manner. In all of your encounters with clients, be truthful and honest. Respect each client's particular rights. Make sure that all of your clients, both present and future, have an equal chance to use and profit from your service. Work to benefit your group and the company you represent. This indicates that your boundaries extend beyond how you interact with clients and include how you control your own thoughts and feelings. Key terms or definitions. Understanding fundamental concepts or definitions is crucial. It will normalize language usage and aid in its standardization among varied communities. There have been various word choice considerations due to the broad reach and target audience. The key terms are following. Staff. Any person, regardless of position, designation, rank, or level of professional expertise, who renders care or service on behalf of the trust. For instance, permanent, temporary, locum, or seconded employees, bank employees, volunteers, employees of agencies, NHSP employees, trainees, and students. The purpose of this policy is to ensure that all staff are aware of it and follow its guidelines. People using healthcare services or service users are clients. This could be a client who utilizes our services and for whom a worker directly provides care. A client who previously received direct care from a worker and is now utilizing our services. A customer of trust services who has never had a business connection with a staff. Person who previously used trust services. A person who no longer receives support and care from the trust but has received care or treatment from the trust or from a group that is now a part of the trust. Therapeutic relationship. A professional bond that prioritizes the care requirements of the individual accessing trust services is known as therapeutic relationship. The employee must always ensure objectivity and openness. Being approachable and friendly towards someone who uses trust services is one thing, but becoming a friend or more than a friend, a personal relationship that is outside the anticipated and proper parameters of a business relationship is another. Boundary. The line separating a business and personal relationship is here. By crossing it, the relationship transforms from being objective to subjective. Intrapersonal limits, for instance, involve choices on how much of our personal beliefs to divulge about ourselves in a professional setting, as well as how much to express ourselves and talk about personal issues. Workers may be questioned during therapy sessions on matters of belief, circumstance, and values, and each question demands careful consideration of the proper course of action. When the line separating a personal and professional relationship is crossed, the relationship shifts from being centered on the performance of a professional responsibility to something more akin to a personal relationship. Personal relationship between workers. It is difficult to define what constitutes a personal relationship between workers, but for the purpose of this course, the following relationships are defined as close personal relationships. Family members, close or familiar relationships, for example, cohabitation, spouse, or partner. A sexual or romantic relationship, inappropriate financial involvement, for example, lending money, etc. Workers who are unsure about whether a close or significant personal relationship may overlap with a professional one are invited to seek guidance in confidence from their manager or other senior colleague, the workforce department, or their trade union representative. Highlights. From this module, you have learned a collection of norms, expectations, and rules are known as professional boundaries. This establishes the moral and technical benchmarks in the social care context. The Hippocratic Oath is the earliest known collection of ethical guidelines for professionals in Western culture. A position of power over your customers will always exist for you as a health and social care professional. Understanding fundamental concepts or definitions is crucial. This could be clients, boundary, staff, therapeutic relationship, etc.
Thank you. You have made it to the end of this module. See you at the next one. Purpose of a professional boundary.
Introduction. A boundary violation can undermine your connection with your patient, put other patients in danger, put your coworkers in uncomfortable situations, and put your employer at accidental risk. Small, repeated boundary crossings can result in a boundary violation, which may have legal repercussions or result in the loss of the license to serve. Crossing lines can have a personal impact on us. Without defined boundaries, nurses are more likely to develop moral anguish, compassion fatigue, burnout, and other negative mental health conditions, including PTSD. This module will provide a general overview of professional boundaries as well as several specific purposes for them, as well as the justification for each. Learning objective. By the end of this module, you will be able to learn about the overview for professional boundary, understand specific purposes behind professional boundary, discuss the organization reasons for professional boundary, explain the reasons for giving professional boundaries.
The overview for professional boundaries. In health and social work, boundaries are a fundamental component of practically everything we do, and they serve as a safeguard for all parties. In the grand scheme of things, all of the groups listed below should anticipate receiving a service from health and social care professionals that is safe, competent, and efficient. Each group needs distinct forms of protection from mistreatment, carelessness, and self-harm. The reasons are clients, people who use services provided by professionals and organizations. Clients may experience abuse at the hands of other clients or employees, suffer as a result of careless businesses, and frequently require protection from either themselves or the results of their actions. Workers, the personnel in charge of overseeing and providing services to customers. Workers need to be safeguarded against burnout or from the fallout when things go wrong, since they may be mistreated by their customers or other employees, suffer as a result of their team's or organization's negligence, or both. In social work and social care, there are 30 professional boundaries. Organizations. Organizations that employ and oversee employees include nonprofits, corporations, and governmental agencies. Businesses must be aware of their obligations to their workers and customers because they stand to lose if their clients or employees mistreat one another. They may face legal repercussions for negligence or both. Funders or stakeholders. Organizations, charities, local councils, and government agencies that give money to organizations are considered funders or stakeholders. Stakeholders must be assured that their money is being used wisely, that they are not funding unethical or careless services, and that the intended outputs and results have been reached. The larger community. Everyone whose life the provided services could potentially have an impact on, either directly or indirectly. The larger community depends on the support services to safeguard and care for themselves, their friends, family, and neighbors, as well as the larger community. Therefore, the effectiveness of the services offered by the employees to the clients is dependent upon all of these groups. The competence of the personnel and managers to operate within their respective fields of expertise determines the caliber of this service. The specific purpose for professional boundary. Even if the necessity for professional boundaries in the health and social care sectors may seem clear, there are a number of particular reasons that might assist everyone appreciate why this is the case. The specific reasons are to establish a safe, supportive relationship. Creating a safe, stable, transparent relationship that is founded firmly on the needs of the customer requires a number of the behavioral guidelines that apply to employees. A customer feels more in control if they know what will or won't happen in specific circumstances. The client can unwind if the relationship's goals, the roles that the worker and client play, and the norms that apply to it are all apparent, to ensure good practice and minimum standards. Any profession must be able to define the standards for its members in order to guarantee good practice and minimal standards. This helps us to define precisely what is expected of employees and companies and gives us benchmark against which to test and assess them. To build and maintain client trust. Building and maintaining client trust is important to us both personally and professionally. Clients provide us with an incredible amount of information about their lives, homes, and families. If we cross lines and abuse a client's trust in us, it will affect more than just us and that client's relationship. It may have an effect on that client's faith in and involvement with services generally, as well as skew other people's perceptions of the field. To ensure consistent service delivery. Boundaries ensure consistency between team members and between various professionals in order to guarantee consistent service delivery. Being a customer of social care services can be a challenging and perplexing experience. Knowing roughly what to anticipate when they encounter a qualified health and social care practitioner is helpful to clients. To establish a foundation for the relationship. The dynamic and fluid nature of the relationship between employees and clients might cause it to change frequently. This relationship can exist in a safe environment with fixed boundaries and methods of operation. To set the limits between clients and workers, boundaries help both clients and employees understand their separate jobs and serve as a means of defining the boundaries between them. In any situation, interpersonal interactions can become challenging, but this is especially true when working with weaker people. Maintaining a professional relationship. Maintaining a professional relationship between clients and employees is crucial for a variety of reasons. It would be simple for the relationship to turn into a personal one given the depth of the connection and the intimate nature of some of the tasks performed. To prevent enhancing clients' vulnerability. Many clients who seek social care services will have a history of abuse and victimization. As a result, they could have low self-esteem and minimal social standing and influence. Due to their potential overdependence on other people's opinions, these clients are extremely susceptible to maltreatment. Organizational purpose for professional boundary. Previous reasons are established to help prevent various specific conflicts between health and social care worker and the client we serve. The reasons below are to safeguard the organization. To guarantee health and security. Boundaries serve to ensure that employees take ownership of preserving their own safety and the health of their co-workers and clients. There are laws governing safety, fire codes, prohibitions on working alone, etc. And it is every employee's professional duty to see that they follow these laws. To avoid burnout. Working in social care can be quite stressful because it requires dealing with the emotions, crises, and difficulties of others on a regular basis. You risk becoming exhausted, cynical, or too interested if you let yourself get too immersed in the problems of your clients and take too much of your work home with you. To prevent misunderstandings, keep in mind that clients who are generally weak, anxious, depressed, or low in self-esteem may be extremely sensitive to a degree beyond what you might anticipate. They are very prone to have unfavorable thought patterns and self-perceptions, as well as unfavorable ideas about how others perceive and treat them. Therefore, it is crucial to exercise extreme caution in both your actions and your speech. To teach the clients about boundaries. If they have terrible parenting, they might not know what a boundaried relationship is. Clients who violate the law struggle to respect some of society's fundamental rules and boundaries. People who have experienced harm or abuse frequently express their emotions through pathological pushing or disregarding of boundaries. Teaching clients about limits or assisting them in managing their personal boundaries is a major focus of health and social care work. It will be quite challenging to support them if we are unable to set some clear personal and professional boundaries for them. To serve as an example for customers. People react to the behaviors they observe in others and will treat you accordingly. Your clientele will become even more erratic if you behave erratically. Aggressive behavior only breeds more aggressive behaviors. You'll receive more boundaries from your clientele if you keep your boundaries strong. To lower the chance of client exploitation or abuse. Although it's not typical, it happens more frequently than one would wish or anticipate. It does help to minimize abuse, to have standards to which we can all hold ourselves accountable, and to have a shared awareness of good practice. Additionally, it gives us, as a profession, a framework for dealing with disciplinary issues so we can deal with the offenders. Clients may not fully appreciate professional limits, making them extremely susceptible to abuse by the people they rely on. They can tell if they are being treated unfairly, if there is some regularity in the way things are done. To provide professional detachment or objectivity. The benefit of working with a professional is that they have the objectivity and detachment to take a step back and view the wider picture. You risk losing that control and attention if your relationship gets too complicated. You will be less helpful to your clients if you lose that focus, which will distort your judgment. The need for these reasons. It could seem quite tedious and needless to constantly think about all of these limitations. Some people believe that anything is fine as long as you don't openly mistreat the clients. There are few golden principles for boundary, which means you should pay attention to the little things and the fundamental daily limits so that you don't run into as many large, unsettling boundary crossings. When limits have been crossed, maintaining boundaries is much more difficult. It takes more work to enforce boundaries when they have been crossed or when there is a general lack of good boundary management, and doing so will result in many more issues in the short run. For both individuals and teams, this is valid. The authority, confidence, and skills of the team or individual are all weakened each time a boundary is not upheld. People pick up on and respond to boundaries in their surroundings. Clients will be able to identify the boundaries of an organization, project, or employee very quickly, both consciously and subconsciously. We all quickly develop an impression of a place or a person based on past encounters, what we observe in the immediate environment, and our intuition. When we perceive that something is efficient and within bounds, we are less likely to want to push those limits. However, we are more inclined to act in boundary crossing ways if we feel that borders don't truly matter. Major boundary crossings nearly always come after a string of small ones. The majority of boundary crossings take place in the context of a relationship between two persons or a group of people. They are extremely rarely solitary incidents. This prior information provides context for the crossing and sets the tone for the relationship dynamics. When a worker crosses a significant boundary, there are usually a number of other seemingly less serious boundary crossings that lead up to it. Highlights. From this module, you have learned small repeated boundary crossings can result in a boundary violation, which may have legal repercussions or result in the loss of the license to serve. In health and social work, boundaries are a fundamental component and they serve as a safeguard for all parties. Boundaries serve to ensure that employees take ownership of preserving their own safety and the health of their coworkers and clients. There are a few golden principles for boundary, which means you should pay attention to the little things and the fundamental daily limits so that you don't run into as many large, unsettling boundary crossings. Thank you. You have made it to the end of this module. See you at the next one. Relationships and professional boundaries. Introduction. Personal boundaries are the limits a person sets for themselves so they don't become overly engrossed in the lives of their clients or fall victim to manipulation or abuse from others. They enable professionals to make unbiased decisions about the therapy process in order to best support patients in achieving their goals. They also help professionals to protect the psychological and physical safety of themselves and their clients. Regarding professional boundaries, this module will address the relationships between clients and health and social care workers. Learning objective. By the end of this module, you will be able to understand what is power imbalance, learn about relationship between social workers and service users, Discuss professional boundaries between workers and former service users. Explain professional boundaries between workers. Power imbalance. The fact that there is a power imbalance in this connection is one of the main justifications for why social workers must manage their interactions with service users, friends and families, and ex service users. This power imbalance occurs because of the following factors. People could not have the freedom to decide whether or not to cooperate with social workers. Instead, they might feel forced to do so. For example, in order to access resources, social workers have access to detailed information about service users and their close relationships. A service user may be in distress, be muddled, or have a mental condition at the time social workers get involved. When statutory action is a possibility, such as the compulsory admission of a mentally ill person or the removal of a child from a family, social workers may be working with individuals. Social workers might have a considerable say in what resources service consumers have access to. Instead of viewing this power disparity negatively, it is important to recognize it as a necessary component of such interactions. Social workers' influence enables them to work with service users to assist them transform their lives for the better. It is possible to abuse this authority though. When social workers establish and maintain their connections with service users, their friends and family, as well as former service users, the presence of this power imbalance should be a key factor. The complex relationship between social workers and service users. Social workers should generally make sure to behave in the social service user's best interests. There are times when the interests of society as a whole must take precedence, such as when a service user poses a risk to others and there can be conflicts between the interests of service users, such as when dealing with a parent and a kid. These are just a few of the challenges that social workers face on the job. The service users may have a misunderstanding of the social worker's service user connection. In other situations, it might be the service user who tries to behave in a way that, if reciprocated, would push a social worker beyond of their scope of practice. No matter what, the social worker must always make sure that the connection is professional and that the service user is aware of the social worker's impact on their life. Social workers may experience strong feelings towards the people they work with or vice versa as a result of spending a lot of time working closely with people in challenging circumstances. Social workers need to be aware of these feelings and to reflect on them. Social workers must be certain that the decisions they take are based on professional judgment and social work ideals. Clients and their relationship with social workers. Service recipients or clients are aware of the power dynamics in their interactions with social workers. They are also able to detect the risks involved in this interaction as well as the beneficial effects that most social workers have. Social and health workers shouldn't develop a personal bond with the client outside of the scope of their employment. The emergence of such a link can happen unintentionally, as in the case of a social worker learning that their child and the child of a service user they're working with attends the same school. Anytime a health and social worker encounters such a circumstance, they should immediately inform their employer. When considering their client relationships and professional boundaries, health and social care workers should think about a few general questions. Relationship questions. Is the goal of your connection to advance the service user's well-being? Your interactions with the service user, do they satisfy your personal needs? Has the service user ever acted in a way that makes you wonder if they don't understand your working relationship? Is your friendship or contact with the service user's family or friends impairing your ability to make professional decisions? Is your only connection to the service user, their friends, and their family one of business? If not, Have you told your boss about this? Professional boundaries between workers and current service users. A professional connection that prioritizes the service user's determined, legitimate demands is the only one that is appropriate between a worker and a client. Workers need to be aware of the power imbalance that results from the service user's need for care, support, assistance, and guidance due to their physical or mental health issues. Each employee has a duty to always uphold proper professional boundaries in their interactions with others. It can be tough physically and emotionally to support and help others. For a service user and staff to interact securely in a professional, caring relationship, appropriate limits are consequently necessary. When dealing with service users who are attempting to establish connections that would cross professional boundaries, employees can also seek guidance from their line manager, professional lead, or professional organization. Under no circumstances can staff members develop close friendships, love partnerships, or sexual relationships with clients. Employees shouldn't act in a way that would cast doubt on their professional conduct or jeopardize the trust that service users, family members, and carers have in the trust to provide care, whether it be within or outside of the workplace. Examples of inappropriate actions or relationships include breaching sexual boundaries, includes having a sexual relationship with a service user and engaging in sexual acts, remarks, or behaviors. Communicating friendships that take place over text messages, the internet, and social networking sites. The trust advises workers to keep personal profiles set to private and prohibits employees from adding service users as friends on social media. Revealing personal information, such as contact information, to service users about oneself or colleagues. Making contact with service users outside of the workplace. Accepting large favors or presents. Establishing a business and association, etc., or entering into a financial arrangement. Interacting improperly with service users' family members while on escorted leave or conducting assessments at their residence. Dealings that take place between the worker and the service user, but that the worker tries to keep a secret from their other co-workers and do not fall under the agreed upon care plan. Reporting potential breaches. When a staff member becomes aware that there is a chance they may have already established non-professional relationship with the service user, they are required to consult their line manager or another senior manager right away. Following a notification of a breach or possible breach of professional boundaries, line management and the employee in question must take action to stop the growth of a non-professional connection. Support, direction, and/or a proper disciplinary investigation might be part of this, but are not required. When co-workers suspect that a relationship between a service user and a worker could be problematic, they should speak up right away to their line manager, another senior manager, or head of profession, if appropriate. The public interest disclosure and raising concerns, whistleblowing policy, and the trust freedom to speak up guardian can both be utilized by employees to submit problems if they don't feel comfortable doing so through the normal management channels. The responsible management must start a fact-finding process right once to talk with the worker involved about the potential for an inappropriate interaction between a worker and a service user. Once such conversations have occurred, the appropriate steps should be taken to prevent the relationship or potential relationship from continuing. The proper steps must be made to guarantee that any issues are reported and investigated using the right procedure, such as a serious incident report, safeguarding referral, and/or a disciplinary investigation. If it is determined that a disciplinary investigation is required, the Human Resource Department should be alerted right once. Professional boundaries between workers and former service users. Sexual contact with a medical professional who assisted in the treatment of a former service user could be harmful. For instance, social interaction with a former service member could lead to the prospect of a sexual or romantic relationship. To reduce the risk of any subsequent allegations of abuse or serious misconduct, which in turn may raise questions about the worker's professional integrity or the integrity of the trust. The worker must seek advice from the line manager as soon as possible if they begin a personal or sexual relationship with the former service user of the trust. Workers must inform the line manager of such relationships as soon as they become aware of them in order to allay any concerns about the professional integrity of healthcare professionals who have relationships with former service users of another trust, where the healthcare professional was involved in their care as a worker of that trust. Professional boundaries between workers. Employees with intimate personal ties shouldn't report directly to each other or be in the same line of command unless a manager who should know about them is aware of them. To prevent one party from being involved in any management procedures or activities that include the other party, such as appraisal, promotion, recruiting, or selection, alternative management arrangements should be put in place. Employees who are dating other co-workers need to be conscious of how they act towards one another at all times when they are at work. The trust expects employees in intimate relationships to conduct themselves professionally at all times while they are at work. Candidates must disclose any relationships they may have with a director, employee of the trust, or other person as part of the hiring process. To protect the integrity of individuals and the trust, workers are required to declare any relationships that may arise between them as soon as they become involved in tasks performed for or on behalf of the trust to their line manager or another senior manager. When a manager is made aware of a close personal relationship between employees who are on the same team, in the same line of command, or who are connected by the provision of business support services such as finance, human resources, IMNT, etc., they're required to work with all parties involved to identify any potential risks and conflicts of interest from the perspectives of both the individuals and the trust. To minimize any conflicts of interest, it should always be feasible to come to an agreement over the standards and setup at work. Options which may be considered are as follows. This list is not exhaustive. No action is required. Altering shift schedules to limit the amount of time people spend working together. This would encompass parents of children who work different shifts, etc. Modifying the obligations of one or both parties, the off-duty health roster can include this. When certain conditions apply, the line manager relationship changes. For instance, another employee who is appropriately qualified would provide supervision in accordance with the documentation of support, such as the documentation of supervision. Changing any mentor or trainee relationships under the aforementioned conditions. Redeployment. All of the aforementioned options, including taking no action at all, must be formally documented and be formally justified in terms of service need and potential dangers. It is necessary to assess working arrangements to prevent conflicts of interest or the perception of them on a regular basis and as needed due to service modifications. Highlights. From this module, you have learned personal boundaries are the limits a person sets for themselves so they don't become overly reliant on others. Social workers may experience strong feelings towards the people they work with or vice versa as a result of spending a lot of time working closely with people in challenging circumstances. A sexual contact with a medical professional who assisted in the treatment of a former service user could be harmful. Employees with intimate personal ties shouldn't report directly to each other or be in the same line of command unless a manager who should know about them is aware of them. Thank you. You have made it to the end of this module. See you at the next one. Professional boundaries and the law. Introduction. Every field of work is accountable for maintaining the appropriate professional boundaries with regard to the law. It is crucial to be aware of all the applicable laws and regulatory guidelines for health and safety. It is not acceptable to use ignorance or a lack of training as an excuse. The relevant laws are relatively simple to find out by doing some investigation. It is the professional responsibility of a health and social worker to keep abreast of and knowledgeable about pertinent legal concerns. There are several different types of laws that deal with or pertain to professional boundaries. This module serves as a reference for the key UK laws that affect professional boundaries in the day-to-day work of health and social care workers the most. Learning objective. By the end of this module, you will be able to learn about the relevant legislation, understand the exception of the legislation, discuss safeguarding vulnerable adults and children, explain equal opportunity in health and social care. Relevant legislation. The key relevant acts in this context are as follows. Mental Health Act. These acts cover the power to detain individuals for their own safety or the safety of the public. Mental Health Act 1983, Mental Health Scotland Act 1984, Mental Health Detention Scotland Act 1991, Mental Health Public Safety and Appeals Scotland Act 1999, Mental Health Care and Treatment Scotland Act 2003, Mental Health Act 2007, Mental Health Scotland Act 2015. Human Rights Act. These enshrine individuals' human rights in British law. Human Rights Act 1998, Scottish Commission for Human Rights Act 2006, Data Protection Act. This act provides regulation of how personal or confidential information and information about public services is managed. Data Protection Act 1998, Data Protection Act 2018. Domestic Violence, Crime and Victims Act. This act created a specific offense of causing or allowing the death of a child, vulnerable adult. Domestic Violence, Crime and Victims Act 2004. Domestic Violence, Crime and Victims Amendment Act 2012. Mental Capacity Act. This act brings together previous laws and best practice on assessing mental capacity and dealing with individuals who have been judged not have the capacity to make decisions for themselves. Mental Capacity Act 2005, Mental Capacity Act Northern Ireland 2016, Mental Capacity Amendment Act 2019. Safeguarding vulnerable groups. These acts set up a system of vetting and barring of individuals working with children and vulnerable adults and place obligations for monitoring and disclosure of abuse of these groups. Safeguarding Vulnerable Groups Act 2006, Protection of Vulnerable Groups Scotland Act 2007. Exception to the professional boundary laws. Even if we disagree or disapprove of what clients are doing, we must respect their wishes and boundaries in the majority of social care settings. There are two significant exceptions to this, which are detailed below. Sectioning or forced detention. Being or sectioning a person with a mental disorder refers to keeping them in a specialized hospital for their safety or the safety of the general public. Because there are numerous different approaches and justifications for holding individuals in custody, each with its own section in the Mental Health Act, it is known as sectioning. Despite the fact there are numerous different sections, the most important information is that someone who is determined to be a risk to themselves and others may be sectioned, forced to stay in a mental health facility for up to 6 months. One doctor may make this decision for emergency detentions lasting up to 72 hours, but 2 doctors must agree if the detention will last longer. If you work in social care and you think one of your clients poses a risk to them or to others, you can ask for an assessment. Call the police if there is an emergency. You can get in touch with your neighborhood social services or mental health trust if no immediate action is required. Mental capacity. As long as they have the mental capacity to comprehend and talk about it, both adults and children have a fundamental right to a confidential service and to give their own permission to treatment. Regarding client confidentiality, this has an important effect. If your customer lacks capacity, it also adds a new set of constraints that you must work within. The 5 principles in Mental Capacity Acts are: until it is proven that a person lacks capacity, it must be considered that they do. A person should not be considered incapable of making decisions unless every effort to assist him in doing so has been made without success. A person should not be considered incapable of decision making solely because he makes a poor choice. A decision or action taken under this act for or on behalf of a person who lacks capacity must be in that person's best interests. Before taking any action or making any decisions, it is important to consider whether the desired outcome can be accomplished more successfully and with less interference with an individual's right and freedom of action. If a client is determined to lack mental capacity, then someone or an official entity must assume responsibility for making decisions on their behalf. All pertinent carers, experts, and family members must be consulted before a decision is made because it cannot be made in a vacuum. You should speak with your line manager right away if you don't feel like you've received all of your training and you have a problem that you think needs a capacity assessment. Professional assessors are on hand to speak with you and offer advice. Safeguarding adults and children. Protecting children and vulnerable individuals from abuse and damage is the main goal of safeguarding legislation and guidelines. It is a field that has expanded and altered significantly over the past years, not only globally, but also one that is having a significant impact on the social care system. Despite previously going by the name protecting, the area is now known as safeguarding. It will undoubtedly alter once more, and the specific steps may also vary. The fundamental ideas, though, won't alter anytime soon and should still hold true. Vulnerable adults. The primary objective of safeguarding laws and regulations is to protect children and other vulnerable people from harm and abuse. Over the past 10 years, the field has grown and changed significantly, not only globally, but also in ways that are significantly affecting the social care system. The sector was formerly called as protecting, but it is now known as safeguarding. It will undoubtedly change again. The exact steps might also change. The core principles, though, won't change anytime soon and should remain valid. Responsibility towards safeguarding adults and children. It is your obligation to ensure that you are fully aware of the various types of abuse as well as its telltale indications and symptoms. Make sure to obtain training in this area if you don't already have it, either through your employer or on your own dime. Make sure you weren't the only one who was aware of what was happening but kept it to themselves. Never assume that someone knows something or is acting in a certain way. Even if you are only dealing with a little portion of the overall picture, until you share information, you will never know if you are dealing with the most crucial component or if you are in possession of valuable knowledge that could be useful to someone else. If you have suspicions, you should get in touch with the police or local social services, depending on how urgent you need a solution and how serious the problem is. It is currently against the law to discriminate against people on the basis of their race, ethnicity, gender, age, sexual orientation, ability, or religious beliefs. There are numerous benefits to working in an anti-discriminatory manner from a professional health and social care standpoint. Being anti-discriminatory means treating everyone equally, abstaining from presumptions, and doing our best to accommodate everyone's needs, to make clients feel comfortable and welcome, and to prevent resentment and hatred from developing. All of these actions are best practices. However, the law makes it more legally binding than merely good manners. It is crucial that as many potential customers as possible may use the service you offer. This means that there must not be any overt obstacles in the way of their assessing the service, that they must be aware of it, that they must be able to physically access it, that they must feel safe, welcome, and at ease while there, and they must not experience any kind of discrimination while they are there. It is important to note that offering equal access or treatment does not mean treating everyone the same. If a client was blind, you would provide them with additional assistance so they could take advantage of the service. For example, you may help them navigate the facility or read any material that wasn't available in Braille. This is a clear example of how to treat people differently while still providing the same service. Their access to the same opportunities is what must be the same. Based on assumptions about someone's race or ethnicity, gender, age, sexual orientation, ability, or belief, it is relatively simple to exclude clients from events or to not provide them the same opportunities as everyone else. You must be sure to analyze everyone's needs, to address those needs where possible and practical, and to treat each person uniquely in your daily practice. Highlights. From this module, you have learned it is the professional responsibility of a health and social worker to keep abreast of and knowledgeable about pertinent legal concerns. Sectioning or forced detention and mental capacity are exceptions to the legislation. It is the obligation of social worker to ensure that they are fully aware of the various types of abuse as well as its telltale indications and symptoms. It is currently against the law to discriminate against people on the basis of their race, ethnicity, gender, age, sexual orientation, ability, or religious beliefs. Thank you. You have made it to the end of this module. See you at the next one. Principles and support for maintaining professional boundaries. Introduction. Both the people who work in the workforce and the people who consume services vary greatly. A culture that encourages employees to build these ties is essential since it takes time and effort to create high-quality working relationships. Some people may feel unclear about how to fulfill their tasks and obligations as a result of relationship-centered working. Professional boundaries may be of assistance here. Both service providers and clients will benefit from having a clear understanding of the nature and boundaries of the working relationship from the outset, which will enable both parties to examine their expectations and figure out how to collaborate most effectively. This module will discuss numerous guidelines for promoting and upholding rigid professional boundaries. Learning objective. By the end of this module, you will be able to understand the principles for maintaining professional boundaries, learn about supporting health and social care workers to maintain boundaries, discuss unacceptable practices, explain appropriate relationships and personal boundaries. Principles for maintaining professional boundaries. Although individual circumstances will vary, principles can stay constant and serve as the foundation for expert judgment. The following guidelines are general in nature to account for variation in setting and situation, and they're applicable whether working with adults or kids. It could seem as though the interaction between a service user and a worker is quite similar to a friendship or other kinds of partnerships. However, it is a working relationship with a clear objective to advance the welfare of the client. The social care professional is in charge of developing and upholding an effective professional connection with the person based on an awareness of their unique requirements and social preferences. The needs and welfare of the person should come first. This includes giving people the chance to actively participate in their life, their relationships, and the care and assistance they receive. All types of communication between social care providers and individuals must adhere to professional boundaries. Any social media usage falls under this. In cases where a person misinterprets or becomes perplexed about their connection, The social care professional is responsible for reaching out for assistance and acting delicately. Alternative care and support must be offered in cases where it is not suitable for a social care professional to give or continue to provide care and support due to the blurring or crossing of professional boundaries. It is important to encourage the social worker to consider and comprehend how providing care affects their own emotional health. In the event that relationship-based practice and maintaining professional boundaries prove challenging for them, they are also responsible for obtaining further support or specialized counsel. Social workers should establish limits in a fair, transparent, and consistent manner. Supporting health and social care workers to maintain boundaries. The health and social care manager plays a crucial role in helping employees adhere to the aforementioned criteria. In order to encourage debate, thought, and study of topics pertaining to professional judgments and boundaries, supervision will be a crucial component. In particular, the health and social care manager should, in order to encourage conversation, contemplation, and exploration of matters pertaining to professional judges, supervision will be crucial. Make sure employees are familiar with the code of conduct for their company. Encourage open communication among employees so they may routinely share best practices, voice issues and concerns, and share their mistakes. Give direction and serve as a good example for employees on how to manage their professional boundaries. Be sure to include a detailed description of tasks and responsibilities in job descriptions. Establish and maintain transparent procedures for risk assessment, care and support planning, and person-centered assessment. Ascertain that each person has a current care and support plan that takes into account their specific requirements, strengths, and plan objectives, and that staff members are aware of the plan and their part in it. Encourage and direct employees to examine and reflect on the nature and caliber of their connections with people through supervision and evaluation, to positively push employees to resolve problems and dilemmas if necessary. Manage employee behaviors and activities that can potentially breach professional limits, making sure that decisions are made openly with consensus and that they're documented. For instance, handling requests for personal assistance not covered by the employee's job agreement. If there are processes, practices, or other areas that could use better, make the necessary changes. Require employees to disclose any current or prior relationships they may have, such as those with friends, relatives, neighbors, or co-workers. Although it might not necessarily stop them from participating professionally, this will make it possible to handle any potential problems. Require employees to disclose any relationships they have with people outside of work, including those they have through social media. Although it might not necessarily stop them from participating professionally, this will make it possible to handle any potential problems. Provide training and development opportunities for employees as needed to encourage reflection on and control over working relationships and limits. Make sure employees understand their obligations to report worries and problems regarding their own or others' personal professional limits. Make sure users of the service are aware of its philosophy, goals, and objectives, as well as the positions, duties, and restrictions of the personnel. Make sure employees are aware of where to go for assistance, care, and support for someone for whom they are neither hired nor qualified to offer, such as counseling, advising, etc. Make sure staff members are knowledgeable on how to assist people in developing and sustaining friendships, intimate connections, and a sense of community. Make sure the person's family and other close friends are aware of the best ways to contact the service, and the staff members are trained to deal with questions, comments, and complaints. Unacceptable practices. Applying the rules for upholding professional boundaries will frequently assist in identifying unacceptable behavior and encourage employees to consider their roles. However, some actions will obviously transgress the law, the code of conduct, and or accepted professional bounds. Whilst we cannot provide a complete and detailed list, unacceptable practices include contact for sexual purposes with a service user, causing someone physical pain or injury, making remarks, gestures, or recommendations that are hostile or derogatory, requesting details about one's past when they are neither essential nor relevant, watching someone undress in inappropriate places, sharing personal or sensitive details with others when it is unneeded, inappropriate embracing, stroking, or touching, withholding information about certain people from coworkers, such as failing to report events and safety concerns, keeping records incomplete, or collaborating with criminal activity, accepting presents and hospitality in exchange for preferential treatment, spreading gossip or rumors about someone or someone close to them, stealing from or misusing someone else's resources, encouraging others to become dependent in order to benefit the worker, giving favored people preferential treatment, such as by spending excessive time with them, getting too involved, or using your position to their advantage, giving care in a way that won't lead to the desired result, where the worker is not qualified to do so, offering specialized advice or counseling, denying someone the agreed upon care and assistance they need, or rejecting them, for instance, because you have bad views about them, attempting to force one's own political, moral, or religious convictions upon another person, failing to encourage respect and dignity. Any actions that are expressly forbidden by the applicable laws, rules, guidelines, or standards. It should be noted that the consent of the individual is never a defense for any of these practices. Appropriate relationships and personal boundaries. An imbalance of power frequently exists in the relationship between a health and social care worker and a client. This may happen, for instance, because the expert has better access to information or resources, or because the person is in a precarious position. Recognizing this imbalance of power, you must not use your position as a professional to pursue or start a sexual or inappropriate relationship with a client or someone close to them. Express your personal opinions to those utilizing services in a way that takes advantage of their gullibility or is likely to distress them, including political, religious, or moral beliefs. You must encourage employees to respect others' limits while forming and preserving healthy connections with them. You need to address any issues. Gifts and donations. For health and social care professionals, the following are a must. You must not prod friends, family members, or carers into giving, borrowing, or leaving presents or money that will directly or indirectly benefit you. You shouldn't demand donations from individuals, family members, or carers under any circumstances. You must abide by all applicable legal requirements pertaining to bequests, contributions, and gifts. Highlights. From this module, you have learned, although individual circumstances will vary, principles can stay constant and serve as the foundation for expert judgment. The Health and Social Care Manager plays a crucial role in helping employees adhere to the principles. Applying the rules for upholding professional boundaries will frequently assist in identifying unacceptable behavior and encourage employees to consider their roles. An imbalance of power frequently exists in the relationship between a health and social care worker and a client. Thank you. You have made it to the end of this module. See you at the next one. Code of Conducts. Introduction. Codes of conduct give employees a detailed explanation of what behavior is required of them, as well as guidelines on what the firm considers to be appropriate behavior. Any organization must have a code of conduct because it provides employees with clear instructions on how to conduct themselves while carrying out their duties. While some organizations expect their employees to abide by a code with numerous requirements, others keep things straightforward. The principles and standards that guide all health and social care professionals will be covered in this module, along with expectations for staff members' conduct. Learning objective. Objective. By the end of this module, you will be able to understand the aim of the Code of Conduct, explain the values and behavioral framework, learn about the professional standards, discuss what happens in failure to follow. Aim of the Code of Conduct. The Code of Conduct aims to clearly define the key behavior that are appropriate and inappropriate in the workplace. Instead of providing specific instructions, it is stated as a set of general guidelines or norms. The Code of Conduct operates in conjunction with other pertinent trust policies, including but not limited to the professional boundaries at work policy, dress code policy, raising concerns, whistleblowing policy, disciplinary policy, dignity at work policy, and the standards of business conduct policy. This list of standards and behaviors is not exhaustive. The purpose of this code is to augment existing professional standards of conduct and codes of ethics, such as the GMC Code of Conduct, NMC Code of Conduct, and HCPC Code of Conduct, rather than to replace them. All employees at a hospital or social care facility, including those on honorary or fixed-term contracts, secondees, bank employees, employees of agencies, contractors, students, and volunteers are subject to this Code of Conduct. Duties. This Code of Conduct should provide guidance to any staff member in professional health and social care should do. It is the responsibility of all staff to read the Code of Conduct and go over any questions you have with your line manager to make sure their conduct complies with the Code of Conduct and other pertinent rules. Keep a factual record of the incident, for example, date, time, location, type of behavior, and witnesses, and take appropriate action when they directly experience or observe behavior that they deem inappropriate. They should also report this to their line manager, the HR department, the staff side representative, or the Freedom to Speak Up guardian. If appropriate, request that the person exhibiting the behavior change their behavior. The staff member should only take this measure if they feel confident talking to the person who exhibited the misbehavior directly. Declare having read and comprehended the Code of Conduct. It is the responsibility of the line managers and supervisors to ensure the Code of Conduct is available to staff. The way they manage their workforce on a daily basis reflects the criteria of the Code of Conduct. Discuss the Code of Conduct and/or behavioral standards during the annual performance review and supervision. Describe the behavior of the workers in a positive light. Take all required actions to address any workplace disputes that may occur. Use the most appropriate policy to deal with employees who don't uphold the required Code of Conduct or behavioral norms, and if in doubt, get guidance from the HR department. Values and behavioral framework. It is clear that various behaviors are appropriate in various settings. This Code of Conduct serves as a guide for employees, expecting them to adhere to the behavioral framework values. The values. The core values in any health and social care sector could be care. Everyone is entitled to the highest quality care. Respect. Everyone should be treated with kindness and respect. Inclusive. Everyone should have access to our services when they need them, and we actively seek suggestions from all on how we can improve. Behavioral framework. The behavioral framework exemplifies the habits we anticipate from every employee and the standards that guide all we do in our day-to-day work life. We care. Empathy. I use empathy to understand others' feelings and respond appropriately. Understanding impact of actions. I use self-awareness to understand the impact of my actions on others and can adapt my behavior according to the person and situation I am dealing with. Kindness. My language, tone, and actions are always kind and considerate when dealing with patients and service users, their families, and my colleagues. Going the extra mile. I regularly go the extra mile to play my part in delivering the best possible care for our patients and service users. Listening, I make time to ask how people are and to listen carefully to them when they talk to me. We respect. I can put myself in your shoes. I recognize that we are all different and always try to put myself in others' shoes to see things from their perspective. Trustworthy. I am honest and always act with integrity. Active listening. I listen actively and with an open mind to patients, service users, families, and colleagues, asking questions to help me understand their point of view. Respecting dignity and privacy. I am always looking for ways to protect the dignity and privacy of patients and service users. Managing expectations. I deliver on my promises. When I can deliver what is expected of me by my colleagues, patients, service users, or families, I am clear about what they can expect and why. We are inclusive, having a can-do attitude and solution-oriented approach. I am quick to find solutions to problems and am always positive about what can be done to deliver the highest standard of care. Flexibility. I am flexible and adaptable when things change and do my bit to make change successful. Knowing when change is necessary. I recognize when change is necessary to improve things. Removing barriers. Where barriers exist between people, whether physical or emotional, I do my best to remove them. Recognizing difference. I treat everyone as a unique and valued individual, recognizing, accepting, and celebrating difference. Involvement in quality improvement. Curiosity. I am always looking for ways to improve the services that I provide. Dedication. I work hard to deliver what is expected of me and set high standards for myself. Professional standards. There are key standards that are expected of staff and are considered to be central to improving patients' and staff experience. These are to never put the safety of a service user in danger, whether it is physically, mentally, financially, emotionally, or sexually. To be aware that the staff-patient relationship is not equal and that every member of staff has a special power, position of trust, and influence over service users. Relationships with service users that are strong, solid, and trustworthy, and to know that while being nice is important, being friends is not the same thing. To uphold and abide by personal, social, and professional limits, including social media borders. To adhere to the dress code's guidelines. To treat your teammates with respect and dignity while cooperating with them in teams. To refrain from advancing your personal interests through the use of your official position or information obtained through your employment. To ensure that you can give an explanation for your actions or inactions and to be responsible for all of your activities. To implement all legally required and workplace training. To perform tasks consistent with your role and obligations. The following processes will be used to monitor the impact of the code: patient complaints, patient survey, patient experience tracker, staff survey, informal and formal employee relations cases. Failure to follow. Failure to follow the code of conduct may result in disciplinary or capability action. Disciplinary action. Employer disciplinary action may result from overstepping your bounds and improperly managing your work and relationships. As a professional providing health and social care, this presents obvious challenges for you, but also poses serious issues for the clients you are assisting. Barring. The potential of being prohibited from working in your specific trade or engaging with vulnerable persons is at the extreme end of disciplinary action. With the introduction of new safeguarding laws and vetting and barring programs, your career in social care may be effectively over. Working with vulnerable folks requires you to use extra caution. Without intending to, it is simple to let undesirable behaviors lapse into neglect. Highlights. From this module, you have learned the Code of Conduct aims to clearly define the key behavior that are appropriate and inappropriate in the workplace. The Code of Conduct serves as a guide for employees, expecting them to adhere to the behavioral framework. The code of conduct serves as a guide for employees, expecting them to adhere to the behavioral framework values. There are key standards that are expected of staff and are considered to be central to improving patient and staff experience. Failure to follow the code of conduct may result in disciplinary or capability action and in extreme cases requires bearing. Thank you. You have made it to the end of this module. See you at the next one. Understanding negative consequences. Introduction. Crossing the line between health and social care or failing to manage client boundary crossings can result in a variety of issues. It is clear that each unfavorable effect might lead to further unfavorable effects and the pushing of further boundaries. In this sense, if a relationship is left unattended, it could spiral out of control, become less focused, and become improper. This module will discuss some of the most typical effects of crossing the line. Learning objective. By the end of this module, you will be able to understand the unrealistic expectations between clients and providers, learn about anger and attachment problems in the health and social care, discuss dependency in health and social care, explain distraction, manipulation, and lack of protection in health and social care. Unrealistic expectations. Uncontrolled behavior frequently results in the client having expectations that the employee is unable to fulfill. If you overstep the mark by providing your client more time during a session, they could start to take it for granted. They may grow irritated if you are unable to go on. This has an impact on the work you produce, and eventually the client suffers as a result. The client will start to demand care that you as a worker are unable to provide if you start to experience role confusion and they begin to view you as a friend or in a parental capacity. Once more, this could create an uncomfortable and unhealthy dynamic in the partnership. Employees that develop an overly emotional attachment to their clients are more likely to begin making false promises to assist the client. In the hopes of using their connections to help the client, a worker might promise access to additional services or housing, for instance. If the promise cannot be kept, the relationship worsens. The employee may be persuaded to work in collusion with the customer on the grounds that the system is unjust or another justification may be employed. Clients withdrawing. Clients are more likely to stop using your services if they don't feel safe or trusted by the way you conduct business. To address a worker about such matters, a client must be unusually courageous and self-assured. Low self-esteem makes vulnerable clients considerably more inclined to withdraw from the service and simply not participate. It can be very difficult for clients to feel strong enough to ask for help because a poor experience can truly set them back and cause further harm to an already vulnerable person. Damage to clients. The trust that the client has put in you might be quickly betrayed by overstepping your boundaries. It can have a very bad effect on their mentality and will harm their chances of receiving the care they truly need. Even though what transpired wouldn't be considered abuse in the usual sense, if you have betrayed trust, your relationship is abusive. Abusive relationships can result in a wide range of negative effects, including feelings of humiliation, shame, guilt, low self-esteem, despair, and loss of confidence. Resentment or anger. If the client you are working with feels like they're receiving the short end of the stick, or if other customers believe you are not treating them all equally and consistently, poor boundary management may cause resentment. There are numerous ways that resentment can manifest itself, and it is obvious that none of them are helpful while interacting with social care agencies. Attachment. The concept of attachment has gained widespread acceptance. This occurs when a person tries to fulfill an unmet demand from a past relationship in a current one. For instance, A client might develop a strong attachment to any female employee who is understanding and forgiving if they come from a very judgmental and unforgiving mother. Clients in many social care settings are more likely to have had a challenging or dysfunctional relationship with their parents, who are people with whom many of us have complex relationships. A skilled social worker will offer the client a secure and gratifying relationship. Unfortunately, clients who have had poor parental experiences are more prone to suffer attachment issues as a result of this. Overly attached clients are more likely to develop dependence, lack of attention, excessive expectations, and to start pushing other boundaries. This will strain the partnership and put stress on the employee. Dependency. A client who becomes overly dependent on a particular professional is more likely to have a long-term disempowerment and may experience negative effects if they're unable to visit the person. Working with a dependent client may be highly demanding and taxing, and despite your best efforts and theirs, the client's behavior may revert to their previous habits, making your work fall flat. In the end, you're setting up a client for failure if you permit or encourage them to depend on you. There are very few social care positions in which empowerment and encouragement are not essential to achieving the goals of the service or relationship. The majority of services will support clients in making or managing changes of some kind. The only people who can truly affect change are those themselves. We cannot do it for them. Dependency is inevitable with some clients and is a normal part of the relationship. This calls for increased awareness and close management of dependency problems. Even if you have a long time to work with a customer, it is important to keep in mind that changes outside of your control could have an impact on the relationship. A relationship may terminate suddenly due to changes in finances, chronic illness, accidents, or job opportunities. Try to maintain a relationship with your customers that will enable them to handle such changes without having a significant negative influence on their daily demands for assistance and quality of life. Distraction from work. Whatever your profession, you will have objectives that you want to achieve. Your initial objectives will lose focus if you let your client's whims, confusion, or multiple needs to pull you from pillar to post. Even if you only give your clients a massage once a week rather than focusing on their bad hip, they could be content just to have someone to talk to. Your responsibility is to offer some professional concentration and detachment though. You risk not accomplishing anything if you allow your client to control every aspect of your time together. Allow yourself to become overly emotionally involved, or if establishing boundaries becomes so difficult that you don't get any work done. Simple restrictions like timekeeping, taking notes, and organization can help you stay focused on your work and prevent sessions from turning into social gatherings. Manipulation. Clients who have been in the system for some time will have a solid sense of what is appropriate and what is not. When you transgress boundaries, there are many ways to manipulate you. Although it is uncommon, outright blackmail can occur. You become more exposed the more barriers you breach. Lack of protection. Working in social care requires a great deal of responsibility since vulnerable people depend on you for support and you must live up to the expectations. Unfortunately, despite our best efforts, issues arise with the system or in the lives of our clients. All of your employers, professional organizations, funders, legal courts, and tribunals will look to you to act within the bounds of your profession. If one of your clients is involved in a serious event or accident, it may result in a compensation claim, tribunal, serious case review, disciplinary hearing, or legal action. There will be intense examination of your actions and methods of operation. If you didn't respect your boundaries as a professional, it would be very seriously considered. You might be able to excuse slacking off and performing tasks improperly in the heat of the moment, but under the scrutiny of an investigation, things will appear very differently. Most of the time, the law, any professional organizations you are a member of, and the company you work for will protect you. if you have followed policy and procedure and done everything according to the book. If you have crossed your limits, you are solely responsible for the consequences of your actions. Highlights. From this module, you have learned uncontrolled behavior frequently results in the client having expectations that the employee is unable to fulfill. If the client you are working with feels like they're receiving the short end of the stick, or if the customers believe you are not treating them all equally and consistently, poor boundary management may cause resentment. Your initial objectives will lose focus if you let your client's whims, confusion, or multiple needs to pull you from pillar to post. Crossing the line between health and social care or failing to manage client boundary crossings can result in a variety of issues. Thank you. You have made it to the end of this module. See you at the next one. Maintaining boundaries. Introduction. It's possible for consumers and health and social care providers to breach some lines of demarcation. It is against the law to cross the line between employees and clients. Every health and social care professional will need to employ a variety of skills and management strategies to maintain and manage both their own and their patients' limits. The approaches and information in this module will assist a worker establish boundaries between clients and coworkers. Learning objective. By the end of this module, you will be able to learn about factors for maintaining boundary, understand being assertive in the health and social care sector, explain how to not take it personally, discuss importance of strong communication, decide on managing dual relations. Factors for maintaining boundary. A health and social care worker frequently has to choose a course of action and determine whether the course of action in question falls inside or outside of the parameters. There is unfortunately no golden rule, but a list of factors that can be considered includes: what needs does the client have? Are there any laws or regulations that apply to this choice? What is my responsibility, and am I acting in accordance with it? What drives the client's behavior? How much other employees respond to this circumstance? What effects will my choice have on the rest of the staff? How will my choice affect other clients, if at all? What effect will my choice have on the life of this client? How will this choice affect my interaction with this client? What inner and outer motives do I have? Do my needs interfere with making the best choice? Being assertive. Assertiveness is a crucial trait for upholding limits. Although the idea is straightforward and very obvious, not everyone can strike the right balance. Finding a balance between being quiet and aggressive is key to being assertive. A person who is aggressive will firmly advance their opinion or viewpoint while honoring the rights and sentiments of others. The degree to which you respect and uphold your own personal boundaries will determine how assertive, passive, or aggressive you are. It can be necessary for you to have conversations that are uncomfortable for both you and the client while dealing with boundary crossings or challenging boundary circumstances. It takes assertiveness to be able to communicate properly and in a way that the client can understand what you mean. Communicate assertively. Assertive communication requires you to listen to what is being said as well as communicating clearly. Be completely honest with what you are trying to express, especially how you feel. Keep your voice steady and no louder than required, and use a firm but non-aggressive tone. Make sure you know exactly what you want. Instead of saying, "It's very messy in here," be direct. I would really like you all to tidy up the communal lounge more frequently. Avoid glaring them out while maintaining a comfortable but steady eye contact. Make sure your posture is calm but confident. Maintain a relaxed yet tall posture while standing. Never express your desires to someone while gazing down at your feet. So you're exhausted after you get back from college and don't feel like doing anything? You say, letting them know you heard what they said. I get it's challenging for you, but if you could find some time to do it, I would really appreciate it. Instead of saying, can't you just do it on Saturday morning? Ask open-ended inquiries that have no predetermined solution. Don't exaggerate or use absolute language. Never, always, everyone, only. Stick to the facts. Instead of saying, this place is never cleaned, it's always completely disgusting, and only I ever do the hoovering. Instead, the living room has only been cleaned once in the last month, and the last time the hoovering was done, it was 2 weeks ago. To your own sentiments, use the pronoun I wherever feasible. For example, instead of saying, we all hate it when the place is dirty, anyone would be annoyed. Say, I find it really frustrating when the place is so dirty and I have worked hard to try and keep it clean. Explaining and communicating boundaries. You can use 4 straightforward tactics to make sure that all of your responses are assured, assertive, and that the customer will pay attention to what you have to say. You can use each one separately, all at once, or in succession. Own your statement. Saying like, I don't think that is appropriate behavior, and sorry, I'm not ready to do that. For instance, you take ownership of the sentence by using the pronoun I, which is effective and shows that you genuinely care about the result. Explain the reasons for the boundary. It's critical that we maintain a professional relationship, she said. It safeguards us both and keeps us focused on the task at hand. You won't learn anything if I do all the work for you, and you'll become dependent on me. The justification not only demonstrates your comprehension of and adherence to the boundaries justification to the customer, but it also clarifies your refusal. Flip it back to the client. Does it matter how you respond to that question in terms of your recovery? What, in your opinion, will occur if I do that? This alters the dynamics of the situation and causes the client to reflect on the problem or their own lives. All of these reactions are far more forceful, assured, and authoritative, and they all have a higher likelihood of redirecting the client's attention away from testing the boundary. Use humor. Humor, when used effectively and successfully, can help elevate a situation or soften a message. It can help people see the other side of an issue without having to force it in front of them by overcoming their defensiveness. Be cautious though, as some people are more adept at it than others. You will create many more issues than you will resolve if you improperly time or judge a comment. Don't take it personally. Customers occasionally can be challenging, irritating, impolite, upsetting, and nasty. They can also be incredibly kind, cordial, complimenting, appreciative, and inspiring. Remember not to take anything personally, no matter how your clients make you feel. To defend yourself, you must grow a thick professional skin. There are a number of things you can do to avoid taking things personally as described below. Look at the big picture. Step back from the situation and look at the bigger picture. What are you hoping to accomplish with this client? How far did you get? What are the obstacles that make it challenging? What is your function? How do you intend to proceed? Analyze the client's behavior. Consider the client and your knowledge of them. Why are they acting in such a certain way? As you can take the time to examine their actions, you will come to understand that they are more motivated by concern about themselves than by concerns about you. Depersonalizing the problems involves fully understanding that it is not about you. Acknowledge and accept your feelings. Our feelings are beyond our control. All we can do is accept them. Do not ignore or suppress your emotions if a client's action or words have an emotional impact on you. It's crucial to accept your emotions, but once you have, try not to allow them to rule your judgments or your thinking. Get support. Having a conversation about a problem while maintaining confidentiality can help you see things more clearly. Talk to a manager or a colleague if you feel that the situation is getting a little personal. Using supervision. Discussing any problems in supervision or line management is one of the most beneficial things you can do to assist yourself manage your boundaries, provided you are fortunate enough to have the necessary structures or the manager's permission to do so. The opportunity to talk about and consider your problems with someone other than yourself is priceless. Instead of waiting until something becomes a problem, talk about problems as soon as you notice them. Because you might be discussing your errors or poor behavior, talking about these issues can be challenging. It is simple to feel embarrassed when discussing boundary problems. A good boss or supervisor will understand that you require a space to talk about or investigate your work practices. Most social care providers cross the line at some point, and it is quite acceptable to acknowledge your error. If you are unwilling to disclose your work practices with your manager or supervisor, even if they're generally understanding, you will be creating a really bad pattern of behavior for yourself. Dealing with the situation will be more difficult because of the guilt and shame of hiding or keeping back the issue. A difficult topic loses some of its power over you once you have discussed it, making it simpler for you to go on. Additionally, there is a good chance that your clients will emulate or pick up on your secrecy. Going to the line management or supervision with a plan of what to discuss is a smart approach. Making a note of boundary concerns that arise between meetings will help you remember them later. Communicating. If you're working in a team, communication is a very evident but crucial component of boundary management. You will be more successful in managing boundaries and boundary concerns if you communicate about them frequently. Highlighting boundaries to clients. As often as you can, you should communicate to your clients your expectations for their actions as well as your own. Don't just say it out loud, and don't assume that a fast review during induction is sufficient. Client boundary warnings. If a client crosses a line, you should inform them of the inappropriateness of their behavior and remind them of their boundaries. Forming a team response to clients breaking boundaries. They won't be able to make wise decisions if your coworkers are unaware of what is happening for the clients you jointly deal with or the clients you exclusively work with. The more you discuss your practice as a team, the simpler it will be to collaborate consistently, and the more you will be able to anticipate and trust one another's judgment. Team discussions. Discussing the boundaries with your team is always worthwhile. The more opportunities you have to work through challenging problems, the more consistent your boundaries will be. Boundary alerts to colleagues. Inform your colleagues if a customer frequently crosses a certain line or if a barrier is crossed in a particularly significant way. They may need to deal with the client, in which case having additional knowledge would help them deal with them more effectively. A little email, call, or even a shout around the workplace can prevent a ton of future effort. Handover or debrief. If your organization has a handover or debrief system in place, be sure to use it to discuss any boundary concerns that may exist. Discussing with managers. You should notify your managers as quickly as possible of anything that might have major implications for you, the company, or the employees. It is much better for your manager to hear about a problem from you first if it has the potential to cast a negative light on you. Personal into professional. Turning something personal into something professional is a straightforward guideline to help you manage boundaries. Frequently, what might otherwise be a boundary crossing action can become a boundary abiding behavior by altering the context of the situation. Here are a few good examples of this in action. Gifts from clients. This is an example of personal into professional crossover that is both widespread practice and well known. In order to make it clear that the gift will be shared, you can accept a gift from a client on behalf of your team, or you can give the gift to the staff Christmas raffle. Receiving a personal gift in this way transforms it into a formal occasion. Books. For a number of reasons, some professional, some personal, employees frequently desire to offer or lend books to clients. It is inappropriate for a worker to give a book to a specific client because it is a private act. Attending events. Clients may invite you as a worker to participate in their festivities or events such as weddings, christenings, award ceremonies, and graduations. Even some of these occurrences might have something to do with the client work you have been doing. It is rather a personal act to attend the event alone, and it can result in a number of issues. However, you could make it a lot more professional if you could attend with other staff members and/or some clients. Managing unavoidable dual relationships. There may be instances when you come across a service user with whom you already have a relationship and to whom you owe a duty of care. Make sure the client gets access to services. It would not be just or acceptable to refuse support only because the person is a worker's relative or works for the manager of the facility. As a worker, you should inform your management right away if a customer who is familiar to you in any way shows up for the service. Don't wait. Dual relationships can soon lead to issues. Refer to another service. Referring the client to another nearby provider that can offer the same support is the simplest and most straightforward way to solve the issue. Managing the crossing within the organization. It could be necessary to engage with the client who has a dual relationship if you provide a service in a more remote area, if there are no other suitable services available within a reasonable distance. If required and practical, you can communicate with other clients to disclose the fact of the dual scenario and outline the course of action. This can disprove any claims of favoritism. Highlights. From this module, you have learned a health and social care worker frequently has to choose a course of action and determine whether the course of action in question falls inside or outside of the parameters. Remember not to take anything personally, no matter how your clients make you feel. To defend yourself, you must grow a thick professional skin. Turning something personal into something professional is a straightforward guideline to help you manage boundaries. As a worker, you should inform your management right away if a customer who is familiar to you in any way shows up for the service. Thank you. You have made it to the end of this module. See you at the next one.